I would like to welcome you all to the final virtual session of the 2024 Perinatal Mental Health Conference. As many of you know and have been a part of, we tried something a little different this year for the 2024 conference. We kicked it off in September with two Perinatal Mental Health 101 trainings provided by Dr. Samantha Greenberg, a family provider out of Kalispell. Those are fabulous resources for you or for anybody that you know of who is just getting into perinatal mental health and looking to understand the nuances or the basics of this topic a little bit more deeply. Those are available to conference or registered conference attendees on the Whova platform. They're also available on HMHB's website and can be accessed for free 99. We hope that those are continued accessible resources that anybody who's interested in advancing perinatal mental health skill and practice can access. And we look forward to having Dr. Greenberg back at some point in the future as well. Additionally, many of you joined us last week at the 2-day in-person event in Helena. It was a fabulous event. We had some wonderful presentations. All of those have been recorded and are being posted on Whova. We did have a small AV glitch, and so some of those Tuesday recordings are still in process, but we hope that those will all be up by the end of this week. And we're looking forward to having those completely posted. And then on Tuesday, we had our first virtual session focusing in on perinatal substance use and talked a lot more deeply about alcohol and tobacco cessation and thinking about how we can, got to meet Dr. Megan Verlage, the new psychiatrist staffing the Prism for Moms line here in Montana. So I encourage you all, if you didn't get a chance to see any of those sessions, to get back into Whova and access those as well. Today's sessions will also be posted there. This year, we have extended the time that Whova will be available for registered attendees all the way until January 15th. We might send you some reminders along the way to get back in there and download those presentations or rewatch them. We hear every single year, oh, dang it, I didn't download this, or oh, darn it. So we might just send you a couple tips and hints. At the end of today's presentation, we will also be sending out an evaluation link. That evaluation will be specifically for virtual sessions. So these two virtual sessions are in person, had a separate evaluation, but after today's sessions conclude, we'll be sending out that virtual evaluation. I will just shout it from the rooftops. We really rely on feedback from you all as the folks accessing these supports to hear if they were, one, meaningful in topic and breadth and depth, and also if they were accessible to you in the way that they were presented. So we really appreciate any feedback. There'll be suggestions in there for future topics as always. And so we just really appreciate any of that honest feedback. We want to make this useful for our perinatal mental health community here in Montana and beyond. So with that, I would like to welcome our first presenter today. When we start cultivating the agenda each year, we reach out to some of our closest partners and try to have an idea about what are folks looking for? What is the things that they're talking about? What are the things that, people in the perinatal period are asking about? What's the hot goss? That is something that we continuously need to, advance education on. And one of the topics that came up when I went and visited with the WIC team here in Montana, who we will also hear from today, was intuitive eating. She mentioned that this was a topic that was, something that a lot of the WIC frontline workers are really finding as, a topic of conversation and really wanted more information on. So I set about trying to find somebody to provide information about that intuitive eating in the perinatal space, and I found Shira. It was not an easy find, I'll be honest with you. So I'm super delighted to bring her expertise to the stage. Shira is a registered dietitian, a culinary enthusiast, a writer, and a mom. She brings both her training and then personal experience into her presentation today. And I really enjoyed getting to know Shira in our initial conversation, and I am super excited to bring her to the stage. I'll turn it over to you, Shira, and I think you should have screen sharing privileges.
Thank you so much, Stephanie. Hi, I'm coming to you from Brooklyn, New York, which is where I am based. And I work with the prenatal and postpartum population here, mainly in New York, and also with families who are starting their feeding journey with their own kids. And intuitive eating is a part of my practice and my training. And so I'm super excited to share some things with everybody today. So I'm going to start with just a little overview. We're going to learn some of the external and internal challenges that kind of contribute overall to diet mentality, define intuitive eating and its 10 principles, explore some of the research on intuitive eating in the perinatal population, and I'll also share some tools that you can take back to your practice in your one-on-one work. So let's talk a little bit about some of the external challenges in our culture. We have a culture that equates thinness with happiness, attractiveness, health, and worth. And overweight is viewed as unhealthy, lazy, failing. In 2025, it's estimated that close to 330 billion will be spent towards supplements, beverages, and meals in the weight loss space. So all of these products that are promising some form of weight loss. The problem with this is that majority of these diets and these products don't work. And when something doesn't work, we don't usually blame the product. We end up blaming ourselves. And so it continues to create this sense of failure. The other problem is that these products promote weight stigma. So it doesn't recognize that people come in all shapes and sizes and have worth just as they are. And these are just some other examples that I've pulled, just a very small fraction of what's out there. But again, we can just see that on a day-to-day basis, the industry is really ramming our heads with these ideas of what the body should look like and our body should look like. Everything from jeans being labeled to skinny jeans to creams being called slim cream for body lotions, posting in magazines what a body should look like after baby. We also now have Photoshop and social media. So this perception of what we need to look, that's not reality. But of course, when you're sitting there and you're flipping through a magazine or you're seeing something online, you're not, there's so much of what you're necessarily not seeing, but that's not really what sticks with us. And then of course, we have our healthcare system, which is very weight-centric healthcare. Obesity is a very controversial and complex topic. In 2013, the American Medical Association voted to recognize obesity as a chronic disease. On one hand, that helped with funding for research and improved insurance coverage, but it really continues to fuel the medicalization of weight. BMI is still used to assess outcomes and medical interventions, and it's not really reflective of everybody. It doesn't consider different ethnicities, muscle, bigger boned, genetics, age, medical history, lifestyle. So nothing is tailored to the person, nothing is individualized, and pregnancy is no different. So when you go in and you're pregnant at your first visit, you're asked, what was your pre-pregnancy weight? You're immediately put into a BMI category based on that. And then a lot of times these very standard interventions come along with that. So those are some of the external challenges, which then fuel these internal challenges. So disconnect, doubt, lack of trust, these obstacles that we have going on all the time within our heads, that really creates this lack of trust in our bodies and our food choices. We end up forming a lot of rigid rules, specifically food rules. And when we have these food rules and this constant guilt that we're feeling when we're eating something, we're not able to enjoy it. People always come to me and they say, for example, if I'm doing a diet recall, they'll say, and then I had a cookie this afternoon and I know I wasn't supposed to do that. Or when people find out that that I'm a dietitian, they'll be like, oh no, like I don't want to tell you what I had for breakfast. It's so bad. So, where are these food rules coming from that we've made up in our head? And all of these external and these internal factors are really disrupting our innate connection. And they're creating this constant food worry. So we are a culture of people who are constantly afraid to eat. You take one bite and you're going to get fat. You're going to get a heart attack or diabetes or cancer. And what's happened is that we've become so worried about the types of foods that we're eating that we're really not able to enjoy what we're eating at all. So the answer to this is making peace with food. And how do we do that? And intuitive eating is a big piece of that. Other things is, becoming more in tune with your body, self-compassion, self-connection, self-awareness. Our culture has a lot to say about our bodies and our food choices, but how do we quiet that noise? And I have this quote, which I just love: the extension of compassion towards the self begins by others extending compassion towards you. And I really feel that that's where we as healthcare providers come in. So making peace with food starts with us, creating that safe space for our patients to begin on this journey, shifting away from that idea of diet mentality, shifting away from the idea that thinness equals beauty, and really being able to start, open the door to this type of conversation. So what is intuitive eating? Intuitive eating is a non-diet, compassionate approach to health, wellness, and food that has nothing to do with diets, meal plans, discipline, or willpower. It teaches you how to tune in with your body cues like hunger, fullness, and satisfaction, while learning to trust your body around food. And intuitive eating, the framework was created by two registered dietitians, Evelyn Tribole and Elise Resch, in 1995, based on their personal experiences working with clients in traditional weight loss healthcare approaches. They noticed that a person's weight and their BMI was a major determinant of health, and they really struggled with this. At the time, there was a few studies that existed that looked at approaches to losing weight that had nothing to do with food choices, and the idea that you were making decisions on what to eat based on your body's inner wisdom and not about food rules, restrictions, counting calories, measuring portion sizes, cookie cutter diet plans. And so Evelyn and Elise were really attracted to this. The other part of the foundation of this is the idea that we are all born intuitive eaters. So babies, when they're hungry, they cry. They're offered the breast or a bottle. When they feel full, they pull off or they release from the bottle. So we're not born with any of these judgments about food being good or bad, or what is considered a proper portion size, or what is considered too much for you to eat. And all of this is learned behavior. And so Elise and Evelyn came up with 10 principles of intuitive eating. I could do a whole hour lecture on the 10 principles themselves, but I'm just going to go through them briefly, and we'll touch base on some of the specific ones a little bit later. So number one is this idea of rejecting diet mentality. So dieting messes you up biologically. It messes up your mind. You have weight loss, weight regain, weight loss again, just fueling this feeling of failure. Number two, honoring your hunger. So hunger is normal. It's a biological balance within the body. It's a direct message from your body saying to you that I would like to be fed. And so what does that mean? It's eating regular meals. It's not waiting to the point of where you feel super dizzy or you feel that hangry, energy. So it's really honoring your hunger no matter when that comes up throughout the day. Number three, making peace with food. So what this really means is this idea of unconditional permission to eat all foods. So an apple and an apple pie, nutritionally, we know that they're not the same, but with making peace with food, emotionally, we are looking at them the same. You are not a bad person if you choose the apple pie over the apple. There's no smart choice. There's no better choice. When you chronically diet, food becomes something that you have to control. So making peace with food is really stepping away from that. Number 4, challenging the food police. So we have a lot of rigid rules that we've made in our heads based on culture, friends, experiences. And at the end of the day, all of these things, these people, they don't know us, they don't know our bodies. So challenging the food police is really brain training to try to block out that noise and reframe those thoughts in your head. Number 5, feeling a fullness. So what does fullness look like? Getting in touch with foods that feel good to your body, that sustain you. Are you eating too much? Are you eating too little? Are you someone who finishes your plate every single time? Are you someone who, when you eat, every time you eat, you always have a stomach ache at the end? Do you feel like you eat and you don't have enough energy? So that's really where understanding what it means to feel that comfortable sensation of fullness. Number 6 is discover satisfaction. So what makes a meal satisfying? Is it taste, texture, aroma, volume, temperature, the physical feeling, the people that you're eating it with? A lot of this also has to come with practicing mindfulness. So I work with a lot of people who will say, like, I eat my lunch in front of the computer, or I'm sitting here standing at the kitchen holding my baby and I'm just scarfing some food down. So we have this complete distraction and disconnection with what we're eating when we're not paying attention to it. A lot of research shows that we end up overeating and or undereating, and we're not really satisfied with the food that we're consuming. Number 7, coping with food. Coping without food, sorry. So how do you cope with your feelings if you don't turn towards food? So a big piece of this is self-care. What are other things that you can do to feel good about yourself that isn't food? Number 8, body, respecting your body. So that fat talk, that body bashing, the body dissatisfaction, that we're constantly telling ourselves, looking at the mirror, pointing out parts of our body that we don't like. I have my little Yoda here that's saying size matters not. So really getting back to basics. Your body is amazing, and what it can do is amazing, and what it's just done, if it's birthed a baby or grown a baby, given birth, on the other side of that, breastfeeding, that's amazing. And what are you doing to respect your body and take care of your body? Is it sleep? Is it friendships? Is it boundaries? Is it going to the spa? And so that's kind of what this framework is about. Number 9, exercise enjoyable activity. So making exercise enjoyable. You don't have to enjoy it. If you don't enjoy something, you're not going to sustain it. So what do you do to promote a love of movement? So it's not, I have to get in my 30 minutes a day. It's more, I'm exercising and I'm moving my body because it fuels me and it fills up my cup and it brings me joy. And then number 10 is health, gentle nutrition. So that's finding flexibility within the rigid diet rules or the rigid rules that are around nutrition. So we are taught how to use nutrition to manipulate and control our bodies, but we don't really learn how to eat or move in a way that truly nourishes us physically and mentally. So gentle nutrition is really about making the decision of what to eat more from a place of self-care and of body respect, and less about self-control and deprivation. So intuitive eating for weight loss, a lot of people will say, like, is intuitive eating a weight loss? Like, is it another type of diet plan? And the answer is no. Intuitive eating, the focus of it is not on weight loss. While there are some studies, specifically this meta-analysis of 26 studies that looked for a link between intuitive eating and weight and BMI. There were some studies that gave evidence that with intuitive eating, weight could be lower or have a lower BMI or weight maintenance with intuitive eating practices in overweight and obese women. It really is not a weight loss strategy. In other studies that showed that compared intuitive eating to calorie restriction was superior in resulting to weight loss. So while you can use aspects of intuitive eating that can be complemented with other weight loss strategies, the focus of it is not on weight loss. So the fourth edition of Intuitive Eating, which came out in 2020, at the time that it was published, it said there were 125 intuitive eating studies. I think at this point, that number is probably close to doubled. So it's still relatively new, but there is a lot of great research out there that shows the benefits of intuitive eating create people who are better attuned with their bodies. They're eating without apologizing. They're giving themselves unconditional permission to eat. They're viewing all foods as emotionally the same. When it comes to their body, they're eating foods that feel good in their body. They're feeling more appreciative of their body. So these are just some of the characteristics that have been shown to be present in intuitive eaters. So in terms of research, it's hard to talk about intuitive eating without taking a moment to address the intuitive eating scale. This is the most widely used, the gold standard in intuitive eating research. It was developed by Dr. Tracy Tilka in 2006. And it had, at the time, it had just 3 sections to it. So this unconditional permission to eat, eating for physical reasons, and reliance on hunger and satiety cues. It took the 10 principles, the 10 framework of intuitive eating, and it broken down into these 3 categories. It has since been updated twice. So the IES-2 came out in 2013, and most recently the IES-3 came out in 2024. Both the IES-2 and the IES-3 have this body food congruence, which includes that the last principle, which is honor your health for gentle nutrition, and more aligning with both your physical needs and your personal preferences. And this is the IES-3. So it went from 23 questions down to 12 questions. I actually couldn't find this online. I had to email Dr. Tracy Tilka to get it, and I did send it along with the presentation. So hopefully you guys have access to this now. But any research that you see that's been done over the last 10 years uses the intuitive eating scale number 2. And the reason why they came out with an updated one was to make the wording a little bit more clear. They wanted to have a greater emphasis on enjoyment and satisfaction. They updated the instructions, and they also made it shorter. So again, brought it down from 23 questions to 12 questions. So any research moving forward will hopefully be used with the IES-3. So let's talk a little bit about the research that exists on intuitive eating and pregnancy. There's not a whole lot of studies, and the ones that are there are mostly focused on seeing if intuitive eating is helpful in pregnant women staying within the recommended gestational weight guidelines when they practice intuitive eating. So kind of interesting because that's not really necessarily what it's used for, but in the pregnancy studies, that's sort of where it comes up. The intuitive eating scale, the second one, was validated. They did add a disclaimer saying your answers may include considerations for food safety, such as listeria, because they noticed that in pregnancy, there's a lot more concerns in regards to food safety that were impacting some of the answers. One particular study showed during first trimester, women with intuitive eating scores were within gestational weight recommendations when their intuitive eating scores were higher, again, on that Likert scale 1 to 5. And another study showed that with a greater intuitive eating score on the scale, there was a 1.7 kilogram lower gestational weight gain. I would say the bulk of the research that I found on pregnancy really applies to gestational diabetes. So higher intuitive eating adherence was correlated with less anxiety and depression in women with GDM, also showed better postprandial glucose and a lower A1C 1 year postpartum. So that's kind of seems to be a big place of where the research in pregnancy is focused on. Intuitive eating in postpartum is a little bit more interesting. So while there is studies that focus on, practicing intuitive eating in the postpartum period and seeing if that predicts greater postpartum weight decreases, and this specific study, you can see 0.2 kilograms lower with a higher intuitive eating practices. So really not that much, but also a really great study that I found that was initially done in 2019 with 419 women. And then the same study was repeated in 2024 with 163 women, looked more into body image, disordered eating, and depressive symptoms. And what they showed is that with those who exhibited greater intuitive eating styles, did have higher body satisfaction, less disordered eating attitudes, and lower depressive symptomology. And the second study, the 2024 study, did have like a free answer section, and some of the questions, again, like looking at sort of more mom influencers and how does the media shape how you feel about your body. This section of the study has not come out yet. Again, this study just came out this year. It says, follow-up will be coming, but that might be something to look into. The social norms place so much pressure on postpartum women to return to their pre-pregnancy shape. And so just knowing that the research that has been done in postpartum shows that intuitive eating principles can really be beneficial in relieving some of that mental stress during this challenging time for mental health to begin with, I think is really wonderful. I want to just touch a little bit on the next phase after postpartum, when you are then feeding your own children, and what does the research show on intuitive eating and new parenting. So we have these 5 feeding styles: restrictive, pressuring, laissez-faire, indulgent, and responsive. Restrictive is when parents limit the quantity and quality of what they're feeding to their infant. Pressuring is a parent pressures a child to finish foods. Laissez-faire, parent does not set limits. The parent is also not attentive. Indulgent is parent doesn't set limits at all. And then responsive is parent is attentive to their infant's hunger cues. And what this specific study, which looked at 200 families, showed was that when parents did not have overly restrictive food behaviors, that they were less likely to exhibit restrictive eating feeding styles to their children. They had higher laissez-faire and indulgent feeding styles. And then parents who relied on their own hunger and satiety cues had higher responsive infant feeding scores. And so I think this is interesting because when I work with young families and we're, specifically working on how do we get our children to engage in intuitive eating and become more adventurous eaters, one of the main things that I always talk about is role modeling, and how as a parent you can role model certain behaviors for your children, showing them by example, you eat when you're hungry, you stop when you feel full, you don't stop because I'm telling you to stop, or you don't keep eating because I'm telling you to keep eating. You're enjoying a wide variety of different types of foods that satisfy you and feel good. So if, your child is only seeing you as mom eat a salad, then that's what they're gonna associate as, oh, like mom's only eating salad. Is that because a salad is healthy? Or, you never see mom stop and get a croissant when she's going out with her children. Or kids pick up on these types of behaviors. And so this is something, again, that's kind of moving forward, is how do we pass on some of these intuitive eating practices onto our children. I want to just address pregnancy, postpartum, and eating disorders, because pregnancy and postpartum are such a high risk period for the onset of disordered eating and or the relapse of a pre-existing eating disorder. And there's really minimal training for medical professionals outside of psychiatry on how to screen and interact with pregnant and postpartum women who present with eating disorder symptoms. I certainly did not have training as a dietitian, and with something that we need to be careful and sensitive, because we know that unmanaged eating disorders do carry risk both for the mother and for the baby. There is a prenatal eating behaviors screening tool called PEBS that was developed at West Virginia University. It has 12 questions that I'm featuring it here, but it has 12 questions. And it's something that I have handed out a handful of times if I'm working with someone who I feel does exhibit very significant restrictive eating behaviors, a lot of really negative body bashing, body talk. The research on this tool, when it was developed, showed that a score of 39 or more meant that the woman had a 16.4 times higher risk of an eating disorder. So it is a great screening tool. That being said, I think you can use it if you don't feel comfortable working with eating disorders, building your referral network and referring a patient out. I did have someone ask me, like, how do you hand this to your patient? Which, got me thinking, like, what is the most sensitive way to present something like this? And I think, the ways that I've done it is I have this questionnaire that I give to all of my patients to learn a little bit more of their dietary habits. And then, if I do notice something that's alarming, I might say, like, are you open to discussing some of these questions a little further, either with myself or, understanding I might not be the best person to do so. So, women want help. We oftentimes don't know how to ask for it. So this is just something that, we have to be mindful of. While intuitive eating is wonderful, there may be times where it's not necessarily the most appropriate. And this is something that, again, needs to either be referred out or dealt with a little bit more sensitivity. So I want to transition and present sort of some tools and some ways that we can, apply intuitive eating into practice. And these are two handouts that in my clinical work were commonly used. The one on the left is for pregnancy. It's a health manners handout. The one on the right is from the Academy of Nutrition and Dietetics. And of course, one thing that stands out to me is the focus on weight gain. So weight continues to be a really big focus of pregnancy and postpartum. And we need to be mindful of the fact that weight is incredibly triggering. And I look at these handouts and right away, like, you're put into a specific BMI category, you're told to gain a specific amount of weight. While we know that optimal weight gain is important for health outcomes in a mother and child, we really need to be sensitive as to how information is communicated. So everyone having their own specific, in your practice or in WIC, maybe you do have specific handouts. And even though these handouts are what are traditionally been given, just being mindful that, there are outliers and they might work for some people, but using your clinical judgment, not every person should necessarily receive this type of a handout. The one on the right that talks about breastfeeding, the section in the box is the entire second page of the handout. Can breastfeeding help me lose weight? How soon should I start losing weight while breastfeeding? What else can help me lose weight? And I've highlighted here in that how soon can I start to lose weight? A slow weight loss, parentheses, less than 5 pounds per week. That does not sound like a slow amount of weight loss to me at all. So really what this handout is showing is there's like such a focus on these expected weight changes and how your body should be bouncing back, when instead, we need to be focusing on postpartum healing, making sure you're getting adequate energy, hydration, and sleep. And so again, like just looking at some of these handouts that are being used in clinical settings and, being mindful of whether you feel like they're the most appropriate for all of your patients. This is the prenatal weight gain grid, again, used in clinical practice. And I also do use these sometimes as well. You can notice that the focus is on pre-pregnancy BMI. It can definitely be a helpful tool if you're working with someone who is very concerned about their weight gain and or, body image. But one thing that I would be mindful of is this whole left section of the handout that again focuses on weight and numbers and specific categories. And even at the top where it says pre-pregnancy normal range weight gain, just because this is the standard of care, you can feel comfortable individualizing that. So when I use these handouts, I don't use the right side and I block out the top, and we really just look at the grid, and then we're able to, advise on different ranges, that are more tailored and customized to the patient that I'm working with. So just a little note on language. So again, being mindful that talking about weight, both in pregnancy and postpartum, can be very triggering. So use your words carefully. Consider omitting some of these BMI category descriptors, and really seeing if you can keep the focus more on behaviors. So maybe it's more of, let's start to challenge some of that food police, some of those rigid rules about what you can and you can't eat in pregnancy, or let's focus on how we can find movement that you can enjoy. And once we're able to do that, that can obviously, maybe help to shift with some of the excess weight gain that's happening, but it's not coming from that specific place when we're counseling our patients. So you can discuss all of these behaviors around weight loss or weight gain without discussing numbers whatsoever. And then these are just some examples of things that I've thought about how they can be worded. So, are you open to discussing your thoughts and feelings about weight gain during pregnancy? Or some of my clients worry about weight postpartum. I don't know if talking about this is helpful to you, but I'm here if you want to discuss it. So just being mindful that every client deserves individualized care and how information is communicated. If you have a patient coming in, they're incredibly nauseous during their first trimester, and they're already feeling so guilty about the fact that they're feeling like they're not eating the right food choices. This may not be the time to be like, well, you've lost 5 pounds, and so that's concerning to me, and that's what we need to focus on. Instead, let's focus on ways that we can get the nausea to feel better. Same thing with like body confidence. You're working with someone who's postpartum, and you can just notice that they're really struggling with postpartum weight retention. They're experiencing a lot of negative body talk. You can work with them on how to reframe that, coming up with ways of showing respect for your body, whether that's showering, brushing your hair, engaging in health promoting activities that can make that person, make them feel good within their body. So just sort of reframing things and helping take the shift away from that idea of weight-centric healthcare. So you may be familiar with this. These are the 5 A's of pregnancy weight gain: ask, assess, advise, agree, and assist. Patients who received counseling were 2 or more of the 5 A's on average gained 11.8 fewer pounds than patients who received no counseling. One of the things that I found most interesting in this family practice article was that clinicians most frequently are assessing and advising, but rarely are they asking, agreeing, and assisting. And I can say also from my experience, especially in my earlier years as a dietitian, I definitely did that. I just went in and assessed and advised the situation based off of whatever I was reading in their chart. And I wasn't asking for permission to talk about certain topics. I wasn't really individualizing the care plan. And then at the follow-up visit, really sitting and going through like, what is working, what is not working. Maybe we need to get some other referrals or some follow-up involved. And so, just being mindful of that. So it's ask, assess, advise, agree, and assist. This is an adaptation of the feelings wheel. This was originally published in 1982, and it was designed to aid people to learn and recognize and communicate better about their feelings. I think about how having something like this in the wall of an office when you first walk in, as opposed to the weight BMI charts that you see a lot of times in clinical offices. So recognizing that our patients are going to come in every day, especially if they're pregnant or postpartum, and that this specific period is a very vulnerable time. You experience a million different emotions over the course of a day. So someone coming in and just having that check-in, like, tell me a little bit about how you're feeling today. And now I can customize and tailor some of my education to you based on how I know you're showing up in my office. So there's so many exercises when it comes to intuitive eating, and I just want to go over 2 of them with you. This one is called the hunger awareness exercise. So this falls kind of in line with the honoring your hunger and feeling your fullness principles of intuitive eating. So you're using hunger and fullness as a guide for how much to eat, as opposed to something like counting calories. So before each meal or snack, you're going to calmly have a check-in with your body and see, how is your body feeling? So what is the hunger sensation that you're feeling? Is it a sharp gnawing pain? Are you hungry for something big like a meal? Are you hungry for something small like a snack? What are the types of foods that you're craving? Is it salty? Is it sweet? And then in the middle of that meal or snack, having another check-in. So are you starting to feel full? Are the flavors that you are eating, are those satisfying you? Or do you maybe want something else? And then towards the end of the meal of snack, doing a final check-in. So what would your body tell you if it could talk? Would it tell you to stop eating now? Would it tell you that it actually, finished eating your plate and it wants more food? Were you happy with the speed of the rate at which you just ate that meal? I know for me, sometimes I eat so quickly with my young kids, and then I look back and I say, well, that meal was 5 minutes. If I had just sat down and really tried to focus more on what I was eating, I would have been able to appreciate this meal a little bit better. So the idea of this hunger awareness exercise, it's not a one-time thing. It is an ongoing experiment to really start to notice patterns with the goal of becoming more in tune with your body and learning how to eat until you feel satiated and comfortable. Again, these are questions that you're asking yourself without judgment. There's no right or wrong answer. Another exercise is the body food choice congruence exercise. So this is a good exercise to do when you feel a little bit hungry. You're thinking about what you might eat. So making food choices that are honoring your health and your taste buds while also making you feel well. So in the past, how has this specific food, if you're thinking, okay, I want to eat a bagel. So in the past, how has this specific food made my body feel while I was eating it? Did it make me tired? Did it make me nauseous? Did it make me have a headache? Did it give me a lot of energy? Again, how did I feel after I ate? Would I choose to eat this food again? Recognizing, like, do you feel satiated after you eat this meal? If so, did it hold you for long enough? Or did you get hungry super quickly after? So asking yourself these questions that can really help to shape the decisions that you're making when eating these foods the next time. The Intuitive Eating Pros website has a section where you can purchase tons of worksheets that you can use to work with your clients. These are just a couple, and again, I shared these when sharing my presentation, so you'll have some of them. But if this is something that really speaks to you, maybe you or your practice could look into purchasing these worksheets. This one specifically is Body and Diet Beliefs worksheet. So this idea of true or false. So for example, asking questions like, if I eat more food, I can eat more food if I exercise more. Is this true based on science? Is this true based on belief? And is this true based on my behavior, true or false? And then reviewing these questions or these statements and discussing their responses. And this would be another intuitive eating principles tracking worksheet. I think it's important to recognize that you don't have to work with a client and do all aspects of intuitive eating. There could just be one or two. So that mindfulness exercise that I shared earlier, which I think is a really, good way to start. So it could just be that you're picking one or two aspects of the intuitive eating principles, and that could be what you're working on. In addition to those handouts, there is the book Intuitive Eating, the 4th edition, that is a great resource, but I'm actually going to recommend you, if there's one thing that you are buying, to get the Intuitive Eating workbook. The workbook has sections that really do go into depth on the 10 principles, but it also has tons of prompts and questions that, it's meant for a person who wants to go through the intuitive eating process to do. But I really think something like this, and for me especially, it's helped tremendously in helping some of my clients just going through some of the exercises together. And then one of the biggest questions that I always get is, can you recommend a cookbook, or can you recommend recipes or website or blog? And while there are, tons of podcasts and tons of Instagram accounts that do focus on intuitive eating and health at every size nutrition and mindful eating, when it comes to like a cookbook that I'm buying to keep on my shelf, there isn't that many options. I really love this book, Gentle Nutrition, which is by Rachel Hartley. And again, the recipes are not necessarily nothing new, but her approach to how you would see these recipes, again, just even starting with something like this triangle, the food pyramid, I always saw on the back of a Cheerios box growing up, and we had all the carbohydrates and the bagels and the bread at the bottom. And here it's really reframing that to show adequacy is the most important thing. So if you don't adequately fill up and fuel your body, it's hard to build on that. So this would be a cookbook that I would recommend. Again, if we're taking this one step further, and now we're on the other side, we've given birth, and now we're focusing on feeding our own kids and how do we raise an intuitive eater. This is a book that recently came out talking about, how do we instill these, continue to do that process of unlearning, but from the start, right, with our kids, and how do we raise an intuitive eater. So I just want to address some of the limitations of intuitive eating. So intuitive eating is a privilege. It was written by 2 women with thin privilege who never dealt with weight stigma. And that's something that we just need to keep in mind. certain populations who, again, significant eating disorders, mental illness, trauma, might not be someone that you would work with from an intuitive eating perspective on. There needs to be more intervention studies. So I mentioned the IES, the intuitive eating scale, number 2, and now number 3. Almost all of the research has, filling out that scale and then applying it to other aspects of life, whether it's body or depression symptoms, or again, weight, and seeing how did someone rank on that Likert scale, comparing that to other things, whereas there's not as many intervention scales of, hey, someone's coming to see me and they have no foundation of intuitive eating. We work with them together, and then we see how did learning intuitive eating over the course of a specific period of time affect all of these aspects of eating and body image. And so I think that's an area that we really need to, the research really needs to focus on. Food insecurity. So the environment plays a big role in what you're eating, and whether you have food access or food deserts. Variety is a lot more limited, and we need to consider cultural and social economic backgrounds when it comes to intuitive eating. Food assistance programs like WIC and SNAP and food pantries play an integral role in mitigating food insecurity. But this idea of getting all of your food or getting all of your benefits at one specific time, how do you counsel someone on intuitive eating in that moment or that week compared to maybe a month later when there's a lot more scarcity in what is available to them? And then this idea of interoceptive awareness, I didn't talk about it so during this specific presentation, but it's the perception of sensation from inside your body. So how attuned are you with your heartbeat, your respiration, your satiety, your autonomic nervous system when it comes to emotions? So much of this connection is unconscious. There's a lot of research that shows that intuitive eaters have much higher links between their interoceptive awareness. And so how do we train people to become more aware of interoceptive awareness? And that's kind of where there's this issue outside of psychotherapeutic approaches and psychology. There isn't a lot of training for that. So that's just something else that we need to be mindful of. Again, if intuitive eating isn't for everybody, or all 10 principles are not for everybody, stress also can significantly affect the way that someone is able to process interoceptive awareness. And we know that pregnancy and postpartum are very stressful times. So in summary, intuitive eating is a non-diet, compassionate approach to health. It teaches you how to tune in with your body cues like hunger, fullness, satisfaction, while learning to trust your body around food again. Weight loss is not the focus, though it's been shown that it can happen. It has a beneficial effect on eating behaviors, diet quality, body positivity, and psychological outcomes in pregnancy and postpartum. And then in terms of counseling, being mindful to both ask, agree, and assist, and not just assess and advise. Consider specific screenings for significant disordered eating. It may not be appropriate to discuss weight with all clients, and then using your own clinical judgment. And again, I will leave you with this quote. So really, the extension of compassion towards the self begins by others. That's us extending our compassion towards you. And here's my contact information.
Yay.
I am going to stop my screen. Should I stop my screen share?
Yeah, thank you so much for that. That's perfect. That was such a fabulous presentation. Thank you so much for sharing all that information with us. We have a small enough group today that if folks would like to come on camera and unmute to ask some questions, we've got about 15 minutes to pick Shira's brain a little bit and talk more about this. I think you presented a lot of novel information that for me personally, I have not seen in a lot of spaces, and thinking about all of the tools that you presented there. I'm gonna lead off with maybe like a little bit more of a nerdy question. I was struck by the research that you presented, and you pointed out how it was really focused on research on intuitive eating in the perinatal period. how it was geared toward that weight restriction or weight loss piece of the puzzle. What are the structural things about how research is built or published, or is that the social-cultural emphasis as well coming through on how, like, the research that's even being done? Because yeah, I don't know. I mean, that reaches deep, but am just astonished that that's the research focus.
Yeah, I mean, I think it just shows how much that is the focus on pregnancy and postpartum, right? So like I said, it's like the second you go into your OB's office, like the very first thing that they do is they ask you for your pre-pregnancy weight, which is
Yeah.
problematic to begin with because a lot of people don't even know that. So they might say, I think it's 150, and then you get weighed and you're 160, and right away you're going to start to be counseled on, oh, you've had all this excessive weight gain in only 6 weeks, right? If you're coming in for your first appointment. So I think part of the reason why it's probably so focused on weight is because our healthcare system, and even in this specific time period, is still so focused on making sure that women gain weight within these recommended guidelines, even though research shows that, like, I don't want to diminish the fact that excessive weight gain does have specific adverse outcomes, preterm labor, miscarriage. It's hard to say whether the rate of higher cesarean, because so many doctors are now just pushing for C-sections. I don't know, I can't speak for Montana, but here in New York, that's a big issue. And so, I feel like that's still where the focus is, and less on what I'm trying to encourage us to do, or where I think we come in, is to almost like take weight out of the conversation and really look at the person as an individual. And even if there's like one care provider in your care team who is able to do that, I think that can be really helpful for someone during this time.
Okay.
I have a question. So for a lot of food, it gets labeled as good or bad. And so I have two young kids, and that's a conversation we have quite a bit. Is like, that's a bad food, that's a good food, and trying to change that conversation from like good and bad to. So I'd be curious on how you talk about it with patients or children,
Yeah.
everyone.
Yeah. So I think you can start by asking, like, why is it good? Like, what makes it good or bad? Right? Like, where did that come from? Like, my kids say that to me too all the time. And I'm like, I don't use that language. So I'm super curious, like, where did that come from? And then, for me, a lot of it is like, all food gives us energy. And that's like, you can get energy from a cookie, and you can get energy from an apple with peanut butter. Again, like the apple and the apple pie, like both of them are going to give us energy, but it really comes down to like, what is the energy that your body's needing right now? And sometimes the answer to that is a cookie, right? Like, I also eat chocolate, and I also like sweets. And sometimes I do crave those types of things. But the other piece of that is like, sometimes the energy is like, I am craving protein. Like, I need like a burger, or I am craving like something green and crunchy. And so maybe that's a salad. And so, putting everything on that neutral playing field of like, all of these foods do give us energy that our body needs, but sometimes our body needs different types of energy, and at different times of the day, we need different types of energy. And so that's sort of like a groundwork to start. But that idea of food being good or bad is so ingrained in us. And so it definitely takes a while to like break that down. And I have to, I have to see people every day who label foods in that way. And depending on whether I feel it's appropriate, we may go down that path of like, can we try to unlearn those labels? And sometimes it's not, there's bigger fish to fry, so to speak. Like, it's like, okay, that's not necessarily going to be what we're going to focus on. But yeah, I really like to reframe the idea of like, everything fuels us. It just fuels us differently. And so listening to your body, like, what is it that you need to be fueled with right now? And it's okay if the answer to that is something sweet or something that you've traditionally thought of as a bad food. That's not a bad thing. And I think that plays into the idea of like, you did eat that, and then how did your body feel afterwards? And so that's something to also be mindful of. And that can happen in both ways, right? Like sometimes I'm craving a burger and I eat a burger, and then afterwards I'm like, oof, that was actually way too heavy. And maybe I did eat too much, or maybe I didn't want that. And you can feel the same way after you eat a donut, right? So it's not exclusive to just those bad foods.
Yeah, that's so helpful. I'll pause and see if anybody else wants to unmute for a question. I had one other question, that something that you, as you were showing the tools, struck me a bit, was, and I think I just have never been thoughtful about it. Like a second question on one of the surveys you presented was something about I've gained weight, and then, in parentheses, fat. And really that's a very small language shift, but is extremely powerful. And even, taking some of this outside of the perinatal time frame and thinking about, overall women's health, and how we even talk about that and think about that, and then, growing body of evidence of how important muscle is, particularly for women in later parts of their life. Like, I'd love to hear if you have any, thoughts about even those small language changes, and if there's any other things that we can do as people speaking, and providing care to women and families.
Yeah, I mean, like get rid of the scale, get rid of like anything that is just gonna define you as a number. Because when I work with someone who's like, but then like we might be working together and they're like, but the number's not changing. And that is what they become so fixated on, as opposed to like, I feel like I have more energy, or my clothes are fitting me better, right? So like you might be exercising and working out and gaining more muscle. That number is not necessarily changing, but like physically, I'm starting to feel so much better about myself. Like people are so quick to lose sight of all that wonderful, positive, things that are happening, because again, they're just so specifically focused on a number. And I think the other piece of that is weight gain, and how do we, again, shift away from this idea that my body is changing and my body is different. And I see that, so much in the postpartum women that I work with, who are like, I just want to get back to my pre-baby weight. And I'm like, or my pre-baby body. And, you just grew a human and birthed a human. And like, can your body ever really go back? Or even the same way that like I'm not emotionally or mentally the same person that I was as a mother as I was when I was 25 before I had kids. Like, so it's like embracing this huge shift. And part of that is also like that physical shift. Like your body can do such amazing things. And how do we get you to focus on that and less on like, I don't fit into my clothes anymore, or those specific clothes. Okay, so let's go get you some new clothes that make you feel beautiful and powerful and strong. And so, a lot of it is, like I said, like I think creating that open space for people to talk about it, and that, that support system, and then breaking down some of these ways that we've always been told and taught that we need to think or feel about our bodies, or again, is being shown to us through the media. Yeah, I don't know if does that answer your question?
Yeah, we're continuing. We got another really good question, which I think this is, thinking about, how systemic the focus on weight really is across our medical systems, and I would say, social and cultural as well. Amy asked, how can we support our clients or patients that interact with other providers that are so focused on weight in their own pregnancy and postpartum weight, as well as their babies, right? Like we're thinking about that not only for, it's that dyad as well, right? Becomes really a strong focus. But is there something supportive we could say that doesn't undermine other providers, right? Like this is, yeah.
Yeah, no, I think that's a really good point. And it also depends on like the type of setting that you're in, right? So if you're in a setting where you have that relationship, like I was in a hospital setting where I had a relationship with other doctors that I was able to go and say to them like, hey, I'm working with someone who's like very sensitive and I'm asking you to please put a note in their chart. Like I don't want them to see their weight. Like that should be something that, you know, if you feel like you need to weigh them, which is a whole other story, but I don't know if everyone needs to be weighted every single visit, but if you feel like you need to weigh them, like they shouldn't be like, this patient shouldn't be privy to that. If you're working with someone who like, they're coming to see you, but all of their providers are outside, then some of it might be helping that patient to advocate for themselves. So even saying like, if this is really hard for you, like I can see how hard this is for you, and I can see that this is really affecting you. Do you feel comfortable at your next OB visit saying, you know, my preference is to not be weighed at this visit, or I would feel more comfortable to not see the number on the scale and turn around and have my eyes closed. This is something that I don't, you know, is not going to help me on my pregnancy or my postpartum journey. So, I mean, not everybody's able to do that, but if we can help them to gain up the courage to advocate for those types of things. But it is really hard. Medical professionals, medical doctors had no nutrition training. I don't know if that's changed really much at all. And the focus is still incredibly weight-centric and on BMI. And so as comfortable as you feel getting involved in that, and then also I think helping your patient recognize that there's nothing wrong with them saying, you know, I need to protect myself. I need to keep myself in a safe space during this vulnerable time. And advocating to not, you know about their weight during pregnancy and or if it is postpartum.
Awesome. Thank you for that. Super helpful. I think a lot of us are in a position to help bring voice and advocate and empower folks, as opposed to, you know, being those medical providers. That's such an important aspect to this conversation.